Hey everyone, thanks so much for being here. I'm Dr. Briana Botsford. I'm a naturopathic doctor and owner of Flow Functional Healthcare here in Edmonton. Today, I'm going to go through an overview of menopause, what you can expect, common symptoms, and help you understand what goes on during this phase of life. Now, let's dig into what actually goes on when you start to experience symptoms of perimenopause. Okay, so we have our handy dandy menstrual cycle here. And what you're seeing on your screen is what's going on in the ovary at the top, body temperature, then hormones that are coming from your brain, your pituitary gland, hormones that are coming from your ovaries, and what's going on with your actual uterine lining. On the bottom, you have phases of the menstrual cycle. This diagram only breaks things into two phases, but some people will talk about more phases of the cycle. We're just going to keep it real simple because really we're not even talking about the menstrual cycle. What we're talking about here is what happens when it starts to change. You can see day 0 or day 1 being the first day of bleeding. And then this is using a textbook 28-day cycle, which commonly can change in menopause as its baseline. So we're going to use this for reference. I want you to understand what's happening normally and then also what starts to change. The other thing that I want you to understand about perimenopause is that you can start to experience symptoms of the late reproductive stage in your mid to late 30s. It can look like changes in your mood, specifically worsening PMS. It can also look like the cycle getting closer together before it gets farther apart. And so you'll start to feel like you're having your period more often, and you will be. You can also start to get some symptoms, subtle symptoms related to low estrogen, things like night sweats leading up to your period, acne lesions that you haven't experienced before, low libido, things like that. So what's really going on here? When we are in our menstrual phase, all of our hormones are low. So estrogen, progesterone are low, LH and FSH are low. As we finish up our bleed, estrogen starts to rise. So we start to get estrogen again, it starts to go up as we get towards ovulation, luteinizing hormone, follicle stimulating hormone, they do a little peak, and that's when estrogen is at its peak. So this is what happens mid-cycle, mid-month when we're actually ovulating. After that, the hormones tank. And so sometimes here, because of this withdrawal, this change from high to low in the estrogen, some folks get mid-cycle spotting here in this part of the cycle. After that dip in estrogen, it will come back up as it mirrors progesterone. Now, you notice what's going on in the ovary up here. After ovulation, we have this cluster of cells called the corpus luteum, and those cells are what create progesterone. And so we only get progesterone created if we ovulate. So sometimes in perimenopause, the body is less enthusiastic about ovulation, or it's doing not as good of a job. And so we'll get an ovulation, but it might not be good enough quality to actually go on to produce these remnants of the follicle in the ovary that produce progesterone. And so the hormones will drop here after ovulation and we'll actually get a bleed right away. Sometimes we make some progesterone, but then kind of mid-luteal or around the day 21 mark, things crash and we start to get a bleed again. But really, if everything's working healthily, what will happen is you'll have about a 2-week phase after ovulation before menstruation where the hormones build up and then we get withdrawal from hormones again. So that change from the high to low of your hormones is what can cause a lot of other symptoms. When we go from a relative high in our hormones to a low in our hormones, we are having the receptors in the body for those hormones are experiencing withdrawal. So hormone receptors for estrogen, progesterone in our brain are experiencing withdrawal. And that's where we can start to get some of these PMS-like symptoms like mood disruption, anxiety, night sweats, things like that that can start to happen when we're going from that high to low phase in our hormones. And then again, during menstruation, our hormones are quite low. And so this is what starts to happen in menopause, perimenopause, is we start to get those less good quality ovulations. So we may not be producing as much estrogen. We may not be producing as much progesterone. So we're starting to move into a lower overall hormone state compared to what we were accustomed to hormonally before. And so it seems like these hormonal changes are what produces a lot of the symptoms related to perimenopause. So hopefully just seeing that little graphical illustration of your menstrual cycle and having a quick understanding of what goes on hormonally throughout the month helps you understand what starts to change as we approach perimenopause and menopause. I want to hear from you what your biggest takeaway was from this video today. You can reply to this email and let me know, or you can email me directly, drbotsford@flowyeg.ca. See you soon.